we'll talk more about T lymphocytes down the road. Okay. Now, there's some argument about why the thymus gland regresses. Does it regress because you're getting older? Or do you get old because it regresses? Okay, and there's some debate about that. Okay. But it's one of those stay tuned deals. Okay. All right, so this is a clearer picture of where it's located, right underneath the sternum.
What age was this?
By late teenagers, 20s, you're starting to not be able to find it. Okay, now the spleen. The spleen is considered to be part of the lymphatic system for two reasons. What it contains and its function. What you're going to see is the spleen is actually not connected to the lymphatic system, it's connected to the circulatory system. Okay. The spleen is not connected to the lymphatic system, it's connected to the circulatory system. So how come it's in the lymphatic system chapter? Because of what it contains and what it does. Okay. It contains lymphoid tissue. It contains white blood cells. It also contains blood, lots of it. In fact, the spleen is sort of a little bag of blood. Now, you can see nicely on this picture, here's your liver over here, here's your stomach, here's your kidneys. See how the spleen is tucked back up in under your ribs? Okay? That's to protect it. An enlarged spleen, or splenomegaly, by definition, is a spleen that you can feel. Okay. Now, when you go to feel the liver, you stick your fingers up under the ribs on the right side, and you ask your patient to take a deep breath. And you may, or may not, be able to feel the liver come down and bump against your fingers. When the liver is very enlarged, you can find it easily. That would be called hepatomegaly. Okay. With the spleen, on the other hand, you do the same thing. You stick your fingers under the ribs, you ask your patient to take a deep breath, and you should feel nothing. Okay. If you do feel something, that spleen is enlarged. Okay. Now, your spleen has a capsule, but the inside of the spleen is made up of reticular tissue. If you remember back 100 years ago when we looked at the tissues, reticular connective tissue was kind of the fishnet hose tissue, very delicate. The reticular tissue inside the spleen gives you lots of little spaces for white blood cells and red blood cells to interact. But it's not the toughest kid on the block. Okay. So if you bang the spleen really hard, that tissue can tear. Okay. Is that a good thing?
No.
No, you don't want your bag of blood bleeding out in your stomach. So, hemorrhage from the spleen, or torn spleen, okay, can get you dead in fairly short order. Okay, now, a couple of stories. Nowadays, we have CTs and MRIs in every hospital. That didn't used to be the case. So, when a person was in an automobile accident, a lot of times they were admitted overnight for observation. Why? Because they couldn't tell whether they had a subdural hematoma in their head, And they couldn't tell whether their spleen was leaking by just looking at an x-ray. Okay? So they would kind of keep them in the hospital and watch them. I was working on a med surg floor one morning, and we had a kid that had come in the night before, teenager, come in the night before with a motor vehicle accident. And he was up walking around, bored to death, waiting for the doctor to come in and release him, discharge him. Unbeknownst to us, he had a ruptured spleen, or a spleen that was beginning to tear. And it went ahead and tore while he was up walking around. Now this was on the med-surg floor, one floor below the OR. By the time they got him to the OR, he was dead.
Wow.
Okay. People can bleed out from a ruptured spleen very quickly. Okay. When I was teaching the paramedics up in Lake City, they had a high-speed chase that went on, and one of the, I think it was a sheriff's deputy that was involved in this chase, wrapped his car around a tree. Okay. And it took them 4 or 5 hours to cut him out of the car. Okay. They had enough time to get his wife to the scene, which was a good thing, because when they got him out of the car and put him on the stretcher, the first thing they did was undo his gun belt. Okay. And when they did that, he bled out and died because he had a ruptured spleen. The gun belt was keeping everything, compressed. Okay.
Mm-hmm.
So, a spleen is not to be messed with. Okay? You have blunt force trauma to the belly is the big deal with the spleen. Now, one disease that affects the spleen is infectious mononucleosis, or mono. Mono causes splenomegaly, and this is why when somebody has mono, they don't let them play basketball or football or any other kind of contact sports. They don't want that spleen being jarred, and rupturing on them. Okay? Now, what are those white blood cells and red blood cells in there doing? Okay? The white blood cells are sort of picking over all the red blood cells, and they are removing damaged red blood cells or elderly red blood cells. They're taking them apart. They're sending the iron either to the liver or to the bones for storage. They're sending the bilirubin to the liver to be released as bile. Okay. So what do you suppose happens to the spleen when you have a disease like thalassemia or sickle cell anemia? You have an overabundance of ineffective red blood cells, so what's the spleen going to have to do?
Work harder.
Work harder and sometimes enlarge.
Mm.
Okay, so an enlarged spleen is something that you see a lot with sickle cell and thalassemia. Now, those sickle cells can gunk up the inside of the spleen, so sometimes you have infarctions and other crud that goes on with sickle cell. Okay, and the spleen in particular. Now, can you live without a spleen? Yes, you can. Okay, but for reasons that I personally don't completely understand, you are more susceptible to specific types of infections. Infections with encapsulated bacteria, which we'll talk about more when we get to micro. Okay.
You would say the spleen is not part of the. It's not
connected to. It's not connected to the lymphatic system. It's connected to the circulatory system. All right, we talked about that. Okay, let's talk about tonsils. Lymph nodes have a capsule. The spleen has a capsule. The thymus doesn't have a capsule. You can flip the lights back, you guys. Okay. Tonsillar tissue doesn't really have a capsule. Or if it does, it's a much more rudimentary capsule. It's not as nice and contained. Now, the lymphoid tissue that's gathered together into tonsils, we said that there are 3 sets of them, 3 pairs, okay, in the upper respiratory area. The first set is called the pharyngeal tonsils. Now, it would be less confusing to students if they called that pair the nasopharyngeal tonsils, because most students associate pharynx with the throat. And that's true, but the pharynx, or the throat, also extends up behind your nose. Okay? So the pharyngeal tonsils, or the nasopharyngeal tonsils, are located behind the nose. They are also called adenoids, and they usually are right next to or they surround the opening to the eustachian tube. So if you wondered why when you have a head cold your ears stop up, okay, there's one reason. Okay? Your ears don't even need to be infected to have your ears stop up. All you have to have is your adenoids swell a little bit, and you'd expect them to swell a little bit when you have a head cold. Okay, the second pair is the palatine tonsils. The palatine tonsils are the ones that you can see when you open your mouth and say, ah. Okay. And they are sort of bumpy looking in there. Now, all tonsillar tissue is put together sort of like this. Okay, you have your tonsillar tissue, and then you have little crypts or grooves in it. Okay, and so forth, all the way along your tonsillar tissue. Okay. These crypts here can catch and hold gunk. Okay, and it smells terrible, yeah. Okay. It can also set up a pocket of infection that's difficult for your body to clear. Okay. Now, nowadays, we don't do tonsillectomies and adenoidectomies nearly as much as we did in the past. The reason is because we figured out that it's not nice to mess with the immune system. So they leave them in if they can. However, sometimes if you have a kid that is having massively repeated ear infections and they can't keep it cleared up, sometimes they want to get rid of the adenoids. Or if the kid can't breathe through his nose because the adenoids are swollen all the time. Or if you have constantly infected tonsil or crypts. Okay? So there are some reasons for taking out the tonsils and or the adenoids, but they don't just go in there and yank them out like they used to. Now, the third set of tonsils are the lingual tonsils, and with a name like that, you know where they are. They're at the base of the tongue. Now, there are other aggregates of tonsillar tissue associated with the gastrointestinal tract. Peyer's patches are lymphoid or tonsillar tissue that are located in the wall of the intestines. Peyer's patches. We also have the appendix, which is between the small intestine and the large intestine.
I'm sorry, can you go back and tell me what you said about Peyer's patches?
Peyer's patches are collections of lymphoid or tonsillar tissue that's scattered all the way down through the gastrointestinal tract. Okay. The appendix is tonsillar or lymphoid tissue that is located between the large intestine and the small intestine. Now, the appendix is shaped sort of like your pinky, okay? And it's hollow. Okay? So in a way, your appendix is like a little tonsillar crypt. Okay? Can your appendix get gunked up just like tonsillar crypts get gunked up? Yes, it can. Okay? And if it can't clear itself out, okay, you can get a localized infection going on there called appendicitis. The problem with appendicitis is, remember, these lymphoid structures don't have the world's best capsule on them. So when they swell and get all inflamed and infected, they can burst. If the appendix bursts, it bursts inside the peritoneal cavity, and the peritoneum is witchy. The peritoneum does not take well to inflammation. Okay, so massive peritonitis, can kill somebody off. Okay? That's why appendicitis can be fatal. Okay. All right. In addition to Peyer's patches and the appendix, you also have mast tissue. That's malt tissue. I think that looked right. Malt tissue. Mucosa-associated lymphoid tissue. Now, when you take histology, like in grad school or something, and they have you looking at slides all the time, you remember when we looked at slides of the gastrointestinal system, and we looked at simple columnar epithelium, it had a brush border on one end, and on the other end it had loose areolar connective tissue, and I would point at some little black spot there and say that's a lymphocyte. Okay. One of the best, easiest ways to find lymphocytes is looking at gut lining tissue. There's a lot of lymphoid cells, particularly lymphocytes, that are just roaming around through the connective tissue that lines the gut. Why is that a good idea?
So you can recognize what you hear.
Because you're absorbing all kinds of crud across that intestinal mucosa, or potentially. Okay? When we get to micro and we see all the different diseaseless organisms that can affect the gut mucosa, you're going to say, yeah, that's a good idea that there's all this lymphoid tissue scattered around throughout there.
So the goblet cells, is that?
Goblet cells produce mucus, okay, and that's pretty much their function. Okay. All right, now a couple of terms here. Lymphadenopathy means that your lymph nodes are swollen. Okay. Does lymphadenopathy tell you why your lymph nodes are swollen? No. Okay.
There we go.
Lymphangitis. Lymphangitis is infection of the little lymphatic vessels. Now, have you ever heard of somebody having a really bad infection in their arm, for example, and they would get red streaks up their arms?
Mm-hmm.
Okay. The red streaks are infection moving along those lymphatic channels. That is lymphangitis. Lymphangitis. Now, what's lymphoma? Lymphoma is cancer, usually localized to the lymph nodes. And there are a bunch of different kinds of lymphomas. Hodgkin's disease is a type of lymphoma. There are some types of lymphoma that kind of are a blend. They include a leukemia component. And again, that makes sense because the cells that are in that lymph node are white blood cells. Okay. Now, lymphadenopathy can lead to lymphedema. How do you get lymphedema? Okay, one way is poor circulation. How so?
I've heard drugs could actually block your.
Okay, now, remember the lymph fluid is supposed to circulate out of the tissue spaces. It's coming from the capillaries. Okay? So it's leaking out of the capillaries. It's circulating through the tissue spaces into the lymph capillaries and then onto the lymph nodes. If something blocks the lymph nodes, can the fluid get through? No. So one type of lymphedema is when the lymph nodes are blocked by cancer, for example, or by worms in the case of an elephantiasis or filariasis. Okay.
It's worms in elephantiasis?
Yeah.
Worms like anywhere.
No. Specific type of worm. Filariasis. Okay, so they're blocking the drainage from the lymph nodes. If you take the lymph nodes and the lymph channels out, okay, do you have anywhere for the lymph to drain to? No. So sometimes you see lymphedema when you have a radical mastectomy. Okay, when they take all of the lymph vessels and the lymph nodes that they can get out, sometimes you see lymphadenopathy or swelling in the arm. There are some congenital causes of lymphadenopathy where the lymph vessels just didn't develop correctly in the first place. Okay. What about heart failure? Why does heart failure cause edema?
Because wouldn't that cause since the lymphatic system drains into the circulatory system through the two veins, so if the heart's blocked, then you can't properly drain.
Yeah.
There you go. Okay. So heart failure is a cause of edema. Okay. High blood pressure can be a cause of edema on the other end because it's forcing too much fluid out into the tissue spaces in the first place. Okay. Do you need to know this? Yes, you do, because there's edema that occurs during pregnancy. Most commonly, the edema that occurs during pregnancy is because somebody's on their feet and they got a baby sitting on their lymphatic return. Okay, so they not only develop swollen, edematous feet, they tend to develop varicose veins at the same time, same reason. Okay, and so what do you tell people whose feet are swelling or who are developing varicose veins? Put your feet up. Okay, that's also why a lot of women, especially nurses and people like that, who are having to carry this baby and stay on their feet, why they wear very thick compression stockings. Okay, to try to keep the stuff flowing on. Okay. When do you worry about the heart, the blood pressure, all that, with edema in a pregnant lady?
When? Like
Yeah.
what time? Usually.
How do you know whether the edema that she has is just because she's been on her feet too much?
Because it doesn't resolve if she puts her feet up and relaxes.
And
the location too.
the location.
If it's in
Okay.
the face and
Face
the hands.
is a whole lot more worrisome. Now with the hands, it's plus or minus. There are a lot of women who, while they're pregnant, can't wear their wedding rings because their fingers are a little bit swollen. But, especially if it's something that happens quickly and it's hands and face, what else?
Other signs, like maybe if they're having headaches or
Headaches,
Visual
abdominal pain,
disturbances,
visual disturbance, blood pressure going out the roof, okay.
protein in their urine.
Protein in the urine. Okay. Now, there is no agreed upon consensus of why or what the initial screw up is with eclampsia. Okay. It's known what happens. It's known what the cascade happens. It's not known what kicks the switch. Okay. So you need to be aware of what the signs and symptoms are. Okay. All right. Now, all that. Now, let's see. I need some volunteers.
No, those are tricks.
Okay. Courtney, thank you. You can volunteer. Who else am I going to pick on? Benita. Back there trying to hide. And Emily, because I'm always forgetting her. And Jen, just because she hasn't been around to pick on for a while. All right. Okay, I want you four to get a group. Pick your group. You can pick your peeps here. Okay. Or you peeps, you can pick a leader here. And I want you to go get that body part. Okay. Find the vessels on the body part and identify them. Okay. And then switch. Desert your leader. Find another one. Okay. Learn the ones on that one. Okay? Everybody got what they're going to do? Very good.
I'm going to make sure that is perfect.
Hey, Cheryl.